I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hello, everybody. Well, today we have an interesting conversation coming right up. I'm very excited to talk with Dr. Kadhim about some of the amazing things he's doing to actually help us within our clinical day to make things sustainable. First, we're going to learn all about him and his journey through medicine, and then we're going to find out all the exciting things he's doing on the back end to help us. Welcome.
Thank you so much, Dr. Smith. I'm so excited to be joining you.
Yeah, you're welcome. We're excited to have you. All right, so tell us about you. So what is about you in your life and your journey through your career in medicine?
Yes, so I am a practicing family doctor. I practice comprehensive family medicine. I practice in Toronto. I've
Wait a
been,
minute. Wait a minute. I forgot to hit record. Oh my
oh,
gosh.
no, I think you did say recording in progress, no?
Did it? Okay,
Maybe
that's
not.
good. I'm like, oh, that's good. Oh no, because I can't see the record button happening. But
Is it
yeah,
recording?
we're recording. That's good. Okay,
Oh,
good. That's all right. My staff will be able to cut this part out. I can't believe I did that. Okay. All
no
right. That's
problem. We could, if you'd like
woo.
to start over, that's okay too. No worries.
Okay, so we're gonna
I've no
let you
rush.
so let's let you introduce yourself. Welcome.
Thank you so much, Dr. Smith. Yeah, super excited to be joining. So I'm a practicing family doctor in Toronto. I practice comprehensive family medicine. I've been in practice since 2018, and I had this dream of opening my own clinic. So in residency, I sort of, start to plan ahead for starting my own clinic. Sure, and that's what I did shortly after residency. I started seeing my own patients, but I also like built the clinic. It was kind of just a concrete slab, and we had to like design it and build all the different pieces. Yeah, and then that and I love like efficiency and tools, so I love listening to your podcast and learning all the tips and tricks. Um, yeah, that's kind of a little bit about me. And then along the way, I'm still doing comprehensive medicine, but I started to get into building a software. But we'll get into that a little bit about like the motivation behind it. But I'm the co-founder of Pippen AI, which is the AI scribe for family doctors. Yeah.
Yeah, okay. All right. So let's back up a little bit. I heard you say you started with a concrete slab and you didn't just open your own clinic. It sounds like you went going building, like put up some capital and actually built a building. Tell us how you even, well, how did you raise the funds? How did you know what the
Yeah.
design was? Did you have partners? Like, I got to know more.
Yeah, absolutely. So yeah, so again, crazy idea I had in PGY2. I was like, looking ahead, and I didn't like the idea of sort of going from place to place to place. So in residency, as you're rotating through different rotations, and every time you start a new rotation, you're kind of starting over. Um, you're not having that continuity with your patients. So I didn't want to have that as, like a sort of an ongoing thing post residency. So I said, well, I want to start my own practice and see my own patients, and I wanted to have sort of stability in sort of knowing that I have a clinic for the next 20, 30 years, right? Um, but you're absolutely right. I mean, it was crazy to sort of say, okay, I need to, buy my own sort of like place and then design it and build it and all that stuff. Um, the now, as medical doctors, we actually have a lot of leverage, knowing that we're, professionals, and we have high earning potential. So I just started, negotiating with banks to sort of get a equity put up to help me, like a loan to purchase the property. And yeah, we went through the whole different banks. We had a business plan, we had projections. And then I actually had a partnership I still have the with a pharmacist who owns the pharmacy in our clinic. So we built not just the clinic itself, but also a pharmacy inside the same
Mhm.
roof.
Mhm.
And that pharmacist, I met him in residency. I was
Yeah.
doing a half day shadowing experience as part of our residency program, and I spent like a half day, and then a year later, I reached out to him and I said, "Yeah, I have this idea. Do you want to partner?" And so that's kind of like how it came about.
Mhm.
And then the place that we purchased is a commercial unit, but it was like a concrete sort of like just open space. And then we
Mhm.
had to hire a designer to figure out all the different rooms and the pharmacy location. And then we went about actually building it. And then I started like 3 months, I think, 2 months post residency, we opened the clinic. So yeah, it was insane, but it was amazing to see that from, to see that being built. And at the time, it was just me as the one doctor working there. I had one staff, and then every year we've grown a little bit, so we added one additional doctor per year. Now we're full. We have four doctors at the clinic. And then my practice has grown, and then over time, so did the paperwork. So I was loving what I was doing, what I was building, but then the paperwork problem started to really ramp up, and I was actually becoming unsustainable, right? And so that's where I had to like sort of think about, well, what can I do to address this problem?
Got it.
Yeah.
Okay. Yeah. Right. Pause for a moment. I got some more questions. Um, who did you model your practice design on? So had you had a mentor or a doctor's surgery that you'd been in that you really loved the layout? Was there something about the way you designed it that would help flow or efficiency? What were the thinking behind the actual inside of this big square box that you had?
Yeah, oh my gosh. So first, like, we hired a professional who did the
Mhm.
drawings and everything. So we relied on their expertise. But in terms of like overall vision, uh, so I love family medicine, and in fact, throughout med school, I did a whole bunch of like electives across different settings. So I went to rural settings, urban, academic, community. And I also went East Coast, West Coast. So I saw all the different areas, and I kind of along that I was thinking about how, the different ways of how clinics are run. Uh, but honestly, in terms of like having someone that says yes, do this and and that, I was actually getting a lot of don't do it. I was getting a lot of like just locum first, or no, this is crazy, like to open your own clinic. So there wasn't like one person that was saying yes, do this. But I did learn from a lot of mentors and preceptors
Mhm.
along the way of how they run
Mhm.
their practices, and so I
Mhm.
tried to sort of emulate some of the learnings I've had along the way.
Mhm. Yeah,
Yeah.
yeah. I know in my early years as a registrar, which is the training, it's like a resident, right, for general
Mhm.
practice in Australia.
Yeah.
Um, your mentors are there to teach you the clinical medicine. And some of them will give you the behind the scenes in terms of the business. So it'll look at what are my costs for the month and what does it take to hire and fire staff. And then if you were really interested and kept asking questions, they'd talk about the legal parts about hire and fire staff and the rules that you have to work within about that contractual law and how to have an onboarding, how to have contracts, how to hire staff. I've done some of that as I've got inside different organizations. I've been in the board levels and things, but this is not something that everybody wants to know. They just want to go to work, see the patients, get their paycheck, go home. You had a curiosity. Was there willingness for those preceptors to say, look, here's my books, here's what it costs for the month, here's what the electricity is, here's what paper costs, here's what the EMR costs, here's what staff costs, here's some of the issues I've had with staff hire and fire. Did you get that because you started asking? How willing were they to tell you those things?
I I didn't get to that level of detail.
Mm-hmm.
Yeah, I don't think I've seen that level of detail. Uh, Now, partly maybe I didn't push enough,
Hmm.
right, to like really get into it. But I remember, yeah, like I remember talking to some of my preceptors who said, yeah, I pay X amount and it's just a flat fee. But
Hmm.
they typically have worked in managed practices
Hmm.
where they either pay a flat fee or a split fee. So they didn't really get into all like the levels underneath it. But I've had more targeted questions along the way with some preceptors. Like for
Hmm.
example, I've reached out to my preceptors about potentially hiring a physician assistant, like a
Hmm.
PA, and they were fantastic. They gave me very specific details about it. Um, so I think you're right. I think it's kind of potentially driven by the resident, by the
Hmm.
junior doctor to get additional information from their mentor and have to push. So maybe I didn't push enough at that time, but
No,
yeah,
I mean, it's just interesting how, I mean, you're obviously still on that path for yourself anyway, and you
yeah,
were able to find the information you needed as you went along. It's,
yeah,
I have learners coming in under me, and I'll say, here's our earnings for the day, here's what each thing we build was, and here's what you'll take home after that. And one of my preceptors said, work for 5 years, get medicine under your belt, and then start doing the business side of things. And I thought that was, at the time, I thought for me that was wise. I had small children at the time, so I wasn't looking to be a practice owner. And in Australia at that time, it was a buy-in. You actually paid money upfront to join a practice as a partner so that you could potentially profit share if there was profits on the back end of that and that sort of thing. You got a panel of patients for the exiting doctor, so you were having a guaranteed amount of patient people to see. There was things like that, and I think that still happens in Toronto, the buy-in piece for some practices, and other practices it doesn't have that same thing. But there's so many different models here.
totally. Oh yeah, and I've gone through so I'm practicing in Ontario and I've gone through all the different ones. I started fee for service, then it
Yeah,
was CCM, then it's
yeah,
FIG, now it's
yeah.
in a full practice. Yeah, and so you kind of just learn as you go. You're absolutely right.
Yeah. It's that adaptation and pivoting based on the models that you're being paid under makes a difference for how you're going to practice and how you have to think as a business owner about the types of staff and the number of staff you're going to bring on and the types of things you're thinking about. You have to hit different targets for different models of payments that
Yeah.
would indicate what staff you need or don't need anymore. Oh yeah, it's a lot of work.
Yeah, absolutely. And actually earlier this year, so it's been 5 years, 6 years since I started. But earlier this year, my New Year's resolution, I know people have different New Year's resolution, but mine was to transform the practice in terms of like our uh keeping up with like the technology and making sure that we have further look on like our efficiencies. And so I actually, since the beginning of 2025 till now, we've introduced a number of things to actually make things run more efficiently. So we've had secure messaging, we revamped our website, we've
Mhm.
introduced this like website form that patients can submit requests directly on the website. We've actually hired a company that helps with some management of like overflow of like phone calls, and
Mhm.
um, we introduce, of course, like Pippen technology,
Mhm.
and it's just like having all of these things. And recently, we also added patient serve. So I was kind of like taking on this opportunity to sort of say, like, we have, quite a lot of volume now for patients.
Mhm.
So how do we make things run smoother and
Mhm.
again, thinking about it from a system level, right? To make it sustainable and
Mhm.
to address some of the challenges we're having. And yeah, and that actually brings me back to like why I started this in the first place, which was
Mhm.
to have some control and say about how I want to structure my day to day, how I want to
Mhm.
structure my clinic.
Mhm.
I think I think us as like physicians, we have a lot of ability to do that if we sort of set our mind to it, and if it's part of
Mhm.
our like vision, we can
Mhm.
definitely make a lot of these changes. Yeah.
Yeah. So tell us the hurt, the paperwork part. What was the paperwork looking like? What was it costing you? How did the day go when you were like drowning in this paperwork? Tell us the
Oh,
before.
oh my God, yeah. So I'll tell you what happened. So first, I'm a father of two children, right?
Yeah.
So and two kids under five. So you
Yeah.
know how, for parents who have kids under five, you know how it is.
Yeah.
But basically, what was happening is my last patient appointment was 3:50, right? So I'm supposed to be done by like 4,
Yeah.
you know, get home and so on. But actually, I wasn't leaving the clinic till 7 p.m., right? By the time I left the clinic, well, it was bedtime for the kids, right?
Yeah.
And so it's like, well, that's like I'm not even, being able to see my kids. So it was
Yeah.
very clear that it has become unsustainable.
Yes.
And that's when I spoke with my wife, Mary, who she's a PhD candidate in epidemiology and data science. And so we're like, well, how are we gonna solve this problem, right? This is like
Yeah.
really taking a toll.
Yeah.
So so we wanted to sort of put our heads together and think about like solutions to make things work. And yeah, and we at the time we were looking at potentially hiring a company or bringing in a software that helps with with some of that paperwork problem. And I think there was one at the time, but it was kind of clunky and it didn't work really well. So we basically said, why don't we put our heads together? Our clinic Vivo is doing well. Things are fairly stable, but it's just more of like addressing this one issue, and we
Mhm.
really wanted to build a solution for it. So
Mhm.
yeah, that's what kind of prompted us to start Pippin, and and this amazing technology was coming at the same
Mhm.
time. So it was like the timing was really fortunate, right? So we're
Mhm.
seeing like this incredible technology of AI solves
Mhm.
problems in many different applications. Could we bring this to family medicine, right? Could we bring this to
Mm.
primary care? So that's kind of like the genesis of how it started.
Got
Yeah.
it. What year was that?
So that was in 2023. We were starting to think about it.
Yeah. So that's when
And
you're drowning in the paperwork, 2023?
yes,
Yeah.
yes, absolutely. Drowning in paperwork. So I think it was like June 2023. We were like thinking about it, and then we started the company. Officially like started the company, did the corporation, hired the lawyer, like did all that, stuff, and then brought together a team
Mhm.
to actually start designing it and developing and
Mhm.
building. And then we launched the company June of last year. So June
Mhm.
2024, that's when we officially launched it, and it's
Mhm.
Canada-wide. We first actually launched it in our own clinic. So I remember it was May 1st, 2024. So it was like that's when we officially launched it in our own clinic, Vivo Family Medicine. And then and from that first day, uh, I was like, wow, like you could, and whenever you like have a change, it doesn't matter if it's like technological or system change or, hiring another person. But when you know that this is working, you immediately feel it, right? You see like, wow, this is actually impactful.
Mhm.
Um, so that's what happened when we first launched in
Mhm.
our own clinic, and then of course we launched it elsewhere. Um, and the other thing, Dr. Smith, I was going to say, like, it's not just the time it takes, right? So, I was leaving 3 hours after seeing
Mhm.
the last patient. It was the cognitive load, right?
Mhm.
The cognitive load of like you're talking to the patient and they bring up multiple things and you're having to remember all these details and they bring up this and you're like, okay, I gotta send a referral for that and I gotta do this test and it's just like building that. So by the end, you're just exhausted and you're like, I don't even know where to begin. Uh, so that's kind of,
Mhm.
that was kind of the thing.
I know it's hard to remember the before, but when you've got that patient in the room and they want to talk about this, then this, and this, and this, were you writing any of that down, or was that all held in your brain till the end of day? How was your day-to-day working in the before moment?
in the before moment, I was writing them down as we
Mm-hmm.
go. So I was jot down something, right?
Mm-hmm.
Um, and it was very like it's kind of disruptive, right? Because you're talking to the patient, you're trying to think about what is the differential, right? What do I
Mm-hmm.
do for this? And then type trying to like switch back to like documenting and then go back to sort of counseling and then they bring up another issue. And so it was really difficult. That's so but yes, I was like sort of writing things down as I go.
Mm-hmm.
Sometimes though, like, if a patient is bringing up something kind of like sensitive or like
Mm-hmm.
they're spilling their guts out, right? You can't just ignore that and like start typing away. You're kind of, I mean, at least for me, I was like,
Mm-hmm.
I had to stop, but they were bringing up a lot of important details, and I'm like sort of trying to keep them stored in my
Mm-hmm.
brain. And then and it's a heavy visit, and then after they leave now I have to like take a breath and like, try to write it all down. So it was, emotional, cognitive load. It was
Yeah.
all of the above.
Yeah.
So I think the combination. Um, but I have to say, like, it's technology itself can only solve so much, right?
Yeah.
So what I'm finding is you can have incredible technology and it helps a lot, but there's still system changes, right?
Yeah.
That need to be addressed. So, for example, if you have a patient who is just bringing 10 things, even though like our AI scribe can document that and write it all down. You still have to do all these tasks, right?
Mm-hmm. Mm-hmm.
And
Absolutely.
so you have to combine, I think the best
Yeah.
solution right now that we have is you combine the two pieces, right? Of course, you have the technology that helps you with the
Mm-hmm.
tedious, repetitive things, but you got to also think about it from a system level and, how do I organize my day and how do I
Mm-hmm.
deal with like sort of requests for multiple things? How do I put up
Mm-hmm.
healthy boundaries, right?
Yes.
I think,
Yeah.
yeah.
Yes. Okay. So I know that as we do our training, any business end things are really left to our own devices in the current way we're taught medicine. So within the medical school and your family medicine, I had no lectures on here's how to run a clinic, here's how to hire and fire staff, here's how to pay wages, here's how to negotiate a good contract. I know you're a university lecturer at the University of Toronto, I think it was. Is that
Yeah.
right?
Yes. Yeah.
Do you see any of that happening now? Any of those topics, issues being discussed or even lectured on with for our current residents? Because I know, this is
Mm.
a big piece of the mental load of working. It's not just seeing the patients and knowing the diagnostic and knowing the management of patients. It's also the everything else. The photocopier is not working and Mary's late to work again today. All of those pieces have an additional administrative burden for doctors.
Yes, absolutely. So at U of T, they definitely have practice management curriculum,
Mm-hmm.
and is done periodically through the 2 years, and it covers important topics, right? So they have like something about billing.
Mm-hmm.
They have other sort of topics that come in. Uh, but yeah, so they kind of try to do this actually. They are trying to incorporate this curriculum um, and there have been some great people that are adding, informally outside of the curriculum, some
Mm-hmm.
incredible support and resources
Mm-hmm.
addressing the needs of of doctors in general. So I think it's a better step, I think, in comparison to before, but
Mm-hmm.
there's still so much depth to it that we're not getting. So
Mm-hmm.
so yes, absolutely. Like I mean the stuff that you're just referring to, like the hiring and the firing, and if someone is not performing, and uh even like more details about like overhead and more
Mm-hmm.
better billing, more optimal billing. Yeah,
Mm-hmm.
there's still so much that
Mm-hmm.
we need to learn.
Yeah.
And
Yeah.
I think it's largely left for the learners to pick up.
Mm-hmm.
based on their interest and their motivation. Um, yeah, but I think, yeah, we would benefit from having additional support.
No,
Yeah.
I'm good. I'm very glad to hear that practice management's being included in part of the training. So I really do think that that clearly is a big part. Okay, now you said New Year's resolution, I'm going to make things more efficient. I'm going to make my practice run better. I want to hear about your tips and tricks for building this team. So you've obviously chosen people who can adapt to your new proposed changes in the clinic, and you start having, I don't know, meetings, conversations. How does this go? How do you kind of turn up January 1st and say, hey, guess what, guys, we're changing everything up, and not have everybody quit on you? Like, tell us the ways of building this team.
Yeah, absolutely. So yeah, practice change, or yeah, like system change is really difficult. And if you have people who are not on board, they're gonna slow down
Mm-hmm.
the progress, and that may kill the plan. So I think for me it was having buy-in from everyone, and really articulating why this is not working well.
Mm-hmm.
Um, so, for example, we started using this website form that patients will submit their request on our website, and instead of emailing us, right? So before it was email and voicemails and so on. And so, when I'm talking to the doctors, the important thing I was trying to communicate to them, for example, is this will create a clear request for you, that is like sort of detailed, patient driven. It will go directly into the chart, so it's not leaving room for mistakes, for example. So if like somebody calls in and says, I need a prescription renewal, and the your staff just sends you a message and they say, patient said they're running out of medication, but they didn't say what medication it was, what pharmacy it was, is going to
Yeah.
duplicate our work.
Yeah.
Whereas now the website form has that information. So the patient just write down the medications that they need, the pharmacy, and all
Yeah.
that stuff, right? So
Yeah.
similarly for our staff, talking to them about why that's important, well, it's offloading some of the work. Instead of having
Mm-hmm.
to field every phone call and
Mm-hmm.
every voicemail, you're
Mm-hmm.
able to you're able to get some of that directly sort of into the chart, and you're just literally importing it. So I think you
Mm-hmm.
have to tailor the message, but part of it is also multiple communications. So I sort of talked to them about the problems, um, talked about sort of like how we can do it, what's the benefit, and then we had regular meetings, and then we had a training
Mm-hmm.
um, to go over it, and then just checking in. So actually,
Mm-hmm.
some of these things don't need a lot of time. Like it may seem
Mm-hmm.
scary, but actually they don't need a lot of time. So my goals for 2025 were for the rest of the year, but I've already achieved it in the first quarter of the year. Because sometimes like these things actually they're no-brainers when you think about it, when you're like, oh yeah, like why do we get every phone call, right?
Mm-hmm.
Uh, Similar for secure messaging. So like one of the issues we were having is every time we get a blood work result, for example, you had to either book an appointment with the patient, or or you have to call them yourself, or maybe relay the message through your
Mm-hmm.
staff. Right? So it just ends up taking a lot of time. But
Mm-hmm.
now and you can't just send an email that's
Mm-hmm.
unsecured with a lot of details and
Mm-hmm.
a copy of the result. But now
Yes.
that you have secure messaging, you can send a
Yeah.
copy of the result, you can counsel them, so
Yeah.
you can actually avoid unnecessary visits, right?
Yeah.
Um,
And
so I
just to
think
explain to people who are hearing that, because you're like, but you're not getting paid for that. But in the model that you're working, you get your income for this patient once a year. And so if you see them 10 times versus one time, you're not expanding the number of dollars you're getting, other than maybe a little bit of shadow billing for each person in person. But
yes.
you within your model right now are trying to reduce the number of times you see a patient per year. Would that be
That's
the,
absolutely right.
yeah,
Yeah, yeah. I work in this capitation model where,
yes,
yes,
yeah.
you're largely getting compensated by salary, so
Yeah.
if you will. Yes, you're
Yeah.
absolutely right. It's not a fee for service model where
Yeah.
you wouldn't be paid otherwise. Yeah.
Yeah, it's
Um,
just interesting to see the different ways people are paid and the different adaptations that come out of that. But for you, sending that message is going to be quality patient care because they're getting information directly from you in a timely fashion about the results. They're not anxious and worried about what did that show. And if they need to follow up, they can come in for an appointment, but at least they've got something from you right away. So it's giving
yes.
them that immediate quality of care, but within a system that contains the back and forward phone calls that we love to not get.
Yeah. Yes, absolutely. And sometimes like yeah, phone calls, like even prior to that, sometimes I would get my staff to call, for example.
Mhm.
But now as a clinic owner, I have to think about the time they spend, right? Because
Yeah,
they have a lot of uh, things that they have to deal with. Like
yeah,
my staff, I mean, we spend a lot of money on our staff for overhead
mm,
because
yeah,
they're dealing with phone calls, voicemails, they were
yeah,
dealing with emails. They
yeah,
have now, like, so it's just like thinking about, well, they have a lot of these tasks and they can't call every patient for everything. So
yeah,
can we offload some of these things?
yeah.
Um, yeah.
Now, if you have one of your little oldies come in because they don't know how to use your new portal, do you have like an iPad at the front that they can put the medicine in that they want to order and put it through the messaging system, or does somebody still talk to them? How does that work right now?
Yeah. Oh yeah, they can still, we have our clinic is actually street front, so they can literally just walk into it.
Yeah,
We still, like people can still just call us and
yeah,
speak with us directly. Uh, the portal of course works, but yes, but they can call us, they can walk in, they can use the portal.
yeah,
So we're still accessible in different ways.
yeah. Yeah.
Yeah.
Okay. Okay. So, but there's no waiting room devices for them to be able to do the portal there.
So the service we're with, they do have these iPads or tablets that you can install. Um, but it would kind of require the same thing. You have to still be a bit techy. No, I mean, not like
Okay.
high tech, but you still need to know how to navigate and stuff. And I find that they don't work as well, actually. I mean, this is why when I got into like software, this is all new to me, right?
Yeah.
But it's just like the idea that things are really clunky. So actually, as a patient myself, I've gone to the hospital where um, we were checking in, and they had one of these devices, and
Yeah.
they had receptionists there who
Yeah.
are like available, but then they said, just use this device, and we're like using it, and then you're clicking, you put your health card, and you put this thing, and then it just didn't work. And then the admin had to like come over and then repeat the process, and she tried it and didn't work. And then she's like, okay, fine, I'll just get your card. But I think this kind of like illustrates how sometimes like the software that we get is built by, software folks who don't have the clinical background,
Hmm.
and they end up making solutions that actually either don't address the problem or they're just not good enough, right? And
Hmm.
that's why I wanted to sort of have my say in terms of like building
Hmm.
something that works for us, like to, for family docs, because it is it is incredibly frustrating when technology
Yeah.
doesn't work. Yeah,
Okay, I want to address something else. So
yeah,
you were 3 hours at the clinic after the last patient.
yeah,
Okay. And then you said to your absolutely adorable Mary, I can't handle this. What do we do? She says, okay, you need to figure this out. You said, okay, I will. And then about a year later, you launch this new product. What was the slowdown or the change that gave you the time to be able to work on this new idea baby in the world?
yeah.
How did you do that? What were the actual steps
Oh,
you took in your
yeah,
clinical day, in your clinical like bookings, appointments? Where did you find this time? It didn't magic. Or was this
right.
the 10 p.m. till midnight?
Yes, yeah, yeah, absolutely. Um, so yeah, that I have to like think back, how did I
Mhm.
find the time? Well, part of it, to be honest, is is actually having the right team around me,
Mm-hmm.
because I did not have to build this, like I didn't have to code it myself, right?
Mm-hmm.
So, as a co-founder, right, I'm sort of putting up the capital and having the team and giving them my input as a medical sort of
Mm-hmm.
director, medical advisor, and lead for it. But the team actually was the one building it. Right. So we had like designers, we had engineers. Mary actually, being the data scientist,
Mm-hmm.
she was spearheading a lot of like these changes and follow-ups and operations.
Mm-hmm.
So thankfully, like I have the team around me, but my
Mm-hmm.
clinical work, I was still going full speed, partly to pay for it because it's expensive to put this team around,
But you
and
still
to
had to think of the idea. You had to go talk to people about getting capital. You had to find engineers. You had to find coders. You had to have a
yeah,
vision for what you needed. You knew
yeah,
the need, but you actually needed to express it in a way that they could go build something for you.
yeah.
That isn't a 5 minute process.
No, no, it was taking time, but I think it's like, you know, I don't know. I have, maybe it's like our medical training where we have this delayed gratitude of saying, you know what, it's gonna be better next month or next week, next year, and just sort of keep like looking ahead, to
Okay.
sort of
Okay.
say,
So it was grit and grizzle and grime. Got it. Okay. So it was in addition to everything you were doing,
yeah,
everything in your clinical days really just staying the same. You haven't dropped patient numbers because you now need the
yeah,
money to be able to pay for this designing thing that you're designing. So you have that true entrepreneur spirit of just get it done, the grit and the grime.
yes. And I will say it was incredibly energizing to work on
Yeah.
this. And it still is. Like I look forward to thinking about building things and like seeing how, we release a new feature and
Hmm.
seeing how that actually now I can use it in my own clinical practice and it's saving me more time. So I
Hmm.
feel like, as you know, a lot of physicians do different things, right? They have their practice, maybe
Hmm.
they do something at the long-term care, or they have,
Hmm.
a side project. I think that's really healthy. Like for
Hmm.
us, as family doctors, we're generalists. We love doing different things. We have varied interests. So I think
Hmm.
this for me is actually like really energizing. Um, but yeah, but just like seeing the vision come true and like how it's practically working is really exciting. Yeah.
Yeah. Yeah. Where do people go if they want to learn more about Pippin and want to learn more about you or reach out to you?
Oh yeah, absolutely. So our website is pippin.ai. So that's Pippen dot AI. I'm available on LinkedIn, of course, and I'll put in even my email address if
Hmm.
folks want to just email me directly.
Yeah.
Um, and yeah, would love to connect with folks and see. I'm going to a whole bunch of conferences and connecting with doctors all across the country,
Mhm.
and yeah, super excited.
Yeah, yeah. And I'm just astounded that you're still within that just over the first 5 years of practice. Like you probably just hit the mark of being over that now. So it sounds like 2018 was when you started your practice, right?
Yes,
Yeah.
yeah,
So like this is early career and you're doing all the hard part of seeing patients and figuring out the medical illness and the diagnosis assessment, build a practice, and then you've gone a step further and said, I'm going to build something new and helpful for me so I can get home to my kids. And we're all in this first like energy bunny right now. That's a
yeah,
lot of
yeah.
energy to put into the world, but we're grateful for the back end of that, which is beyond just your clinic. You've been able to say, here's something that might help my colleagues.
Absolutely, absolutely. Yeah, and I'll say like one of the reasons why maybe I'm able to achieve some of these things is again building like the system for it. So like in my own clinic, for example, I have incredibly supportive staff, right? Because I
Mm-hmm.
handpick them, like I select
Mm.
them, I give them training, so like that training sort of pays dividends, right? We have like all kinds of ways to make sure things are run really smoothly. So like I invest in like those things
Hmm.
early on, and that has really allowed me to, to be able to handle like the medicine, because you're
Hmm.
absolutely right, medicine is tough. And then dealing with like the complexity, right? Challenging encounters and all that stuff. But yeah, but it's been great, and yeah, and I think building something for family doctors is incredibly rewarding to help. So I help my colleagues in our own clinic. So we have four doctors total, and I find now, like with Pippin, I can reach out to all across the country and support family doctors, and that's been incredibly helpful and yeah, rewarding. Yeah.
Yeah, yeah. Okay, so now I have some, now that you're on the other side of building your own clinic as a resident, you're building your
Yeah.
own clinic. What would you say to the person who's in residency now who has the bee in their bonnet to build their own clinic too? Is that a yes or no? Because you said all the preceptors said no, don't do it. And now you went and did it. What would you say to the one
Yeah.
who's like highly motivated and wants this for themselves too? Would you say yes or would you say maybe?
I would say I would say yes if you're interested, right? If
Yeah,
you're motivated and you know what you're getting into, I would
yeah.
say yes, go for it. Uh, but like for the right reason, right? Like if you want to build it and you want to sort of make the changes and see how it's
Mhm,
working and build the
mhm,
team, right? I would say yes, absolutely go for it. But yeah, but there are a lot of naysayers, and like when I
mm,
started,
mm,
I remember I asked the question actually in one of the Facebook groups, right? And I asked a question, and then I remember this one comment from a doctor that says, "No, uh, just if you want to invest, invest. Otherwise, you're gonna be calling the plumber in the middle of the day." And that note, that comment stuck with me. I was like, oh my God, one day we're gonna have an accident and I'm gonna have to call the plumber. And that incident finally happened 6 years later. But literally it was painless. I just, messaged someone, the plumber came in, fixed everything, same day. It wasn't that hard. So so if anyone is listening and they're getting like the naysayers, I would say go for it. You can do it just as long as you're interested and you know what you're getting yourself into.
Yeah, yeah, yeah. And is there any advice you'd give someone who is thinking about adding a side gig, adding a practice, adding, is there anything to kind of overcome the naysayers? Is there anything that you would have liked or found really helpful that could help you on your journey?
Yeah, absolutely. I think again, like being generalist, we have varied interest, and I
Hmm.
find that sometimes when you have like different interests, you learn from them, and that goes back into the medicine, right? It
Hmm.
enriches you as a family doctor. And so I think by all means, I think it's great to have that like sort of side gig or side hustle or interest, right? And that, I mean, I don't have like the evidence to support it or the data, but I probably would say it would make us better doctors to have that, creativity and time off to like decompress and think about other things, right?
Hmm.
So yeah, yeah.
Do you get any holidays?
Say that again, sorry.
Do you get any holidays? Do you get away?
Actually, yes. Well, so with the pandemic, things really slowed down, but I love
Yes.
to travel, and I'll tell you, for Pippin, how the idea came to us. We were doing a road trip in Nova Scotia. We were doing the Cabot Trail, so we're just
Hmm.
driving
Hmm.
around, seeing this incredible scenery. And Mary and I were sort of thinking about like what we want to do, and that's actually when Pippin came up. So kind of like forcing this idea, like just step away from what you're doing for a
Hmm.
living, and then you might get a you get struck with a eureka moment, right? Yeah.
Yeah.
It's really now it's becoming challenging because anytime I have a little bit extra, I'm sure if I have those two additional babies on top of my
Yeah,
children
yeah, yeah,
that I'm doing the clinic and then Pippin.
yeah.
So it is challenging, but yes, I do try to still take time off. Yeah.
So I agree. Those road trips are quite an exciting and dangerous time for your brain to have free time to roam around in that big old brain of yours and come up with some incredibly fun and scary ideas. I was on a road trip with husband. This was many years ago, down to see my parents. It was a good 6 hour drive. And I said to him, I could go around Australia now. We'd always planned to go around Australia as grey nomads. When we were retired, grey hair, and away around Australia, you travel. That's the Australian thing to do. And I said, yep, I could take the kids out of school. They were grade 2 and grade 5. I could take the kids out of school and we could go do it now. He's like, you're kidding. You'd give up the house, the career, the everything. You'd give it up and you'd go traveling around Australia. I said, absolutely. And we made that happen a year later. So
Oh
it's
my
that
God.
those discussions in the car as you're driving along, you're like, hey, I just had this eureka moment. I could actually say, yes, I'll close everything down. We'll sell the house. We'll buy a truck and a caravan and away we go into the sunset and make it happen. So be aware the road trips, guys.
That's such an interest. Oh my God. So you actually did it. Oh my
We
God.
did,
Yeah.
we did. Off we went to the
Wow.
sunset and I locumed here and there to pay for groceries and petrol. And
Wow.
we put the kids in homeschool, which in Australia is super easy. To have to give them a learning plan,
Yeah.
as in the Queensland school education system has to have a learning plan from me to say, I will actually educate my children while taking them out of school for 2 years. And we traveled and we made the best memories with our children for those. Well, it was a year and a half, and then we ended up on a beachside suburb for 6 months figuring out how to get to Canada. And we
Wow.
locumed
That's
there while we did
incredible.
that. So
It's so
but
true.
these fun and amazing things can happen to you if you want them. So whether it be a new program that helps your family doctor colleagues or a change of life for you, like things can happen if you just give yourself the space away from the busyness. So
Yes,
I love your road
absolutely.
trip story. It was like, oh yeah, I've had one of those moments. We've
My
had
God,
many
yeah,
more
such a
than that,
change,
but take yourself on a road
right?
trip, guys.
Such a powerful change. Yeah, absolutely. Yeah, road trips.
Road trips, too much time to think, and a whole lot of idea babies might happen. So, yeah. All right. Well, thank you so much for this conversation. Is there anything you'd like to leave our listeners before we close down? Is there any pearls of wisdom, final comments that we didn't talk about that you'd to just give them for our wrap up?
Yeah, thank you so much for having me. No, just change can happen. Just, put it down on a piece of paper and start making it happen. It's remarkable how if you have a vision, people do come around, and rally behind that idea. And I think I think the impact is really big. And yeah, I'd love to connect with anyone who wants to talk to me about that. Thank you again, yeah, for having me.
Yeah. Thanks, everyone. Have a great rest of your week. Bye. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.